Anxiety disorders. Anxiety disorders go beyond the usual worry or stress everyone feels from time to time. They involve intense, excessive, and persistent feelings of fear or dread that can significantly disrupt daily life. People with anxiety disorders often experience a constant sense of unease or worry, even when there's no immediate threat or clear reason to feel anxious. This can be accompanied by physical symptoms such as a racing heart, sweating, trembling, dizziness, or shortness of breath. Common types of anxiety disorders include generalized anxiety disorder, where worry focuses on various aspects of daily life, panic disorder, marked by sudden and unexpected panic attacks, and social anxiety disorder, where intense fear of social situations leads to avoidance of social interactions. The causes of anxiety disorders can be a mix of genetics, brain chemistry, and life experiences. Treatment typically involves cognitive behavioral therapy, CBT, which helps individuals challenge and change their thought patterns, and medications that can help regulate brain chemistry. With the right support, people with anxiety disorders can learn to manage their symptoms and improve their quality of life. Bipolar disorder. Bipolar disorder is characterized by extreme mood swings that include emotional highs, known as mania or hypomania, and lows, known as depression. During manic episodes, individuals may feel euphoric, overly energetic, or unusually irritable. They might engage in impulsive behavior, talk rapidly, and require very little sleep. In contrast, depressive episodes bring intense feelings of sadness, hopelessness, or a lack of energy, making it difficult to engage in everyday activities. These mood swings can last for days, weeks, or even months, and can significantly impact relationships, work, and overall quality of life. The exact cause of bipolar disorder isn't fully understood, but is believed to involve a combination of genetics, brain chemistry, and environmental factors. Treatment often includes mood stabilizers to help regulate mood swings, psychotherapy to provide support and strategies for managing the disorder, and lifestyle changes, such as regular sleep patterns and stress management techniques, to help stabilize mood. Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder, or OCD, involves recurring, unwanted thoughts, obsessions, and repetitive behaviors, compulsions that individuals feel compelled to perform. These obsessions might include fears of contamination, doubts, or intrusive thoughts about harm, while compulsions are actions taken to alleviate the anxiety caused by these obsessions, such as excessive hand-washing, checking locks, or counting. Although these behaviors may temporarily reduce anxiety, they often interfere significantly with daily life and can become all-consuming. OCD is believed to result from a combination of genetic, neurological, behavioral, and environmental factors. Treatment typically includes cognitive behavioral therapy, CBT, specifically exposure and response prevention, ERP, which involves gradual exposure to the source of anxiety without engaging in the compulsive behavior. Medications, such as selective serotonin reuptake inhibitors, SSRIs, can also be effective in managing symptoms. With proper treatment, many people with OCD can learn to manage their symptoms and lead productive lives. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, develops after experiencing or witnessing a traumatic event, such as a serious accident, natural disaster, combat, or assault. People with PTSD often experience intense, disturbing thoughts and feelings related to their experience long after the traumatic event has ended. Symptoms include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. Individuals may also experience emotional numbness, avoid places or situations that remind them of the trauma, and have increased arousal symptoms, such as being easily startled or feeling tense. PTSD can disrupt daily life and relationships and can be debilitating if not properly treated. It is believed to be caused by a complex interplay of genetic, psychological, and environmental factors. Treatment often involves psychotherapy, such as cognitive behavioral therapy, CBT, or eye movement desensitization and reprocessing, EMDR, which help individuals process the trauma and develop coping strategies. Medications can also help manage symptoms, particularly those related to anxiety and depression. Attention deficit/hyperactivity disorder, ADHD. Attention deficit/hyperactivity disorder, ADHD, is a neurodevelopmental disorder that affects both children and adults, making it challenging to focus, stay organized, or control impulses. Symptoms of ADHD include inattention, such as difficulty sustaining attention, forgetfulness, or making careless mistakes, hyperactivity, such as excessive fidgeting or an inability to stay seated, and impulsivity, such as interrupting others or making hasty decisions without considering the consequences. These symptoms can significantly impact academic performance, work, and relationships. The exact cause of ADHD is not fully understood but is thought to involve a combination of genetic, brain structure, and environmental factors. Treatment for ADHD often includes behavioral therapy, which helps individuals develop organizational skills and coping strategies, medications like stimulants, which can help increase attention and reduce impulsivity and hyperactivity, and lifestyle changes to support better management of symptoms. Eating disorders. Eating disorders involve severe disturbances in eating behaviors and related thoughts and emotions, which can lead to significant physical and psychological problems. Common eating disorders include anorexia nervosa, characterized by an intense fear of gaining weight and severe restriction of food intake. Bulimia nervosa, involving cycles of binge eating followed by purging or other compensatory behaviors. And binge eating disorder, marked by regular episodes of eating large amounts of food without purging. These disorders can lead to serious health complications, such as malnutrition, electrolyte imbalances, heart problems, and mental health issues like anxiety and depression. Eating disorders are often linked to a combination of genetic, psychological, and cultural factors. Treatment typically involves a comprehensive approach, including nutritional counseling, psychotherapy such as cognitive behavioral therapy, CBT, to address distorted thoughts and behaviors related to food and body image, and medical monitoring to manage physical health. Schizophrenia. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may experience a range of symptoms, including hallucinations, such as hearing voices or seeing things that aren't there, delusions, which are false beliefs that aren't based in reality, and disorganized thinking, which can lead to jumbled or incoherent speech. Other symptoms include reduced emotional expression, difficulty in maintaining relationships, and a lack of motivation. Schizophrenia typically begins in late adolescence or early adulthood and can significantly impact a person's ability to function in daily life. The exact cause of schizophrenia is not fully understood but is believed to involve a combination of genetic, brain chemistry, and environmental factors. Treatment usually involves antipsychotic medications to manage symptoms and various forms of therapy, such as cognitive behavioral therapy, CBT, to help individuals cope with the condition and improve their quality of life. Borderline personality disorder, BPD. Borderline personality disorder, BPD, is a mental health condition characterized by intense emotions, unstable relationships, and impulsive behaviors. People with BPD often experience rapid mood swings, feelings of emptiness, and a strong fear of abandonment, which can lead to frantic efforts to avoid being left alone. They may also have difficulty controlling anger, experience paranoia, or engage in self-harming behaviors. These symptoms can make it challenging to maintain stable relationships and function effectively in daily life. The exact cause of BPD is not fully understood but is thought to involve a combination of genetic, environmental, and brain-related factors, particularly experiences of trauma or neglect in early childhood. Treatment for BPD often includes psychotherapy, such as dialectical behavior therapy, DBT, which focuses on teaching skills for managing emotions, improving relationships, and reducing self-destructive behaviors. Medications may also be used to help manage specific symptoms like mood swings or anxiety. Autism spectrum disorder, ASD. Autism spectrum disorder, ASD, is a developmental disorder that affects communication, behavior, and social skills. People with ASD may have difficulty with social interactions, exhibit repetitive behaviors, or have restricted interests. Symptoms and their severity can vary widely from one individual to another. Some people with ASD may be highly functioning with minor social challenges, while others may have significant disabilities requiring substantial support. ASD is typically diagnosed in early childhood, often by age 3, and symptoms can range from mild to severe. The exact cause of ASD is unknown, but it is believed to involve a combination of genetic and environmental factors. Early intervention, including behavioral, educational, and speech therapy, can significantly improve outcomes for individuals with ASD by helping them develop communication and social skills and manage behaviors. Dissociative disorders. Dissociative disorders involve disruptions or breakdowns in memory, awareness, identity, or perception, often as a result of severe trauma. Individuals with dissociative disorders may feel disconnected from themselves or their surroundings, a condition known as depersonalization or derealization. Dissociative identity disorder, DID, formerly known as multiple personality disorder, is a type of dissociative disorder where a person has two or more distinct identities or personalities that control their behavior at different times. These disorders are thought to be coping mechanisms for dealing with overwhelming stress or trauma, particularly in early childhood. Treatment usually involves psychotherapy, which focuses on integrating the different aspects of identity and helping the individual process traumatic memories. Therapy can also help develop healthier coping mechanisms and improve overall functioning. Phobias. Phobias are intense, irrational fears of specific objects, situations, or activities that pose little or no actual danger. People with phobias often go to great lengths to avoid the feared object or situation, which can significantly disrupt their daily lives. Common phobias include a fear of heights, acrophobia, fear of spiders, arachnophobia, and fear of flying, aviophobia. While most people recognize that their fear is excessive or unreasonable, they feel powerless to control it. Phobias are believed to be caused by a combination of genetic and environmental factors, such as a traumatic experience or learned behavior from a family member. Treatment for phobias typically includes cognitive behavioral therapy, CBT, particularly exposure therapy, where individuals are gradually exposed to the feared object or situation in a controlled way to help reduce their fear response over time. Panic disorder. Panic disorder is characterized by recurrent, unexpected panic attacks, sudden periods of intense fear or discomfort that peak within minutes. Symptoms of a panic attack can include a pounding heart, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, and a fear of losing control or dying. These attacks can be terrifying and may lead individuals to worry about when the next attack will occur, often resulting in avoidance of places or situations where previous attacks have happened. The exact cause of panic disorder is unknown, but it is thought to involve a combination of genetic predisposition, brain chemistry, and environmental factors. Treatment typically involves cognitive behavioral therapy, CBT, to help individuals understand and manage their panic symptoms, as well as medications like selective serotonin reuptake inhibitors, SSRIs, or benzodiazepines to reduce the frequency and intensity of attacks. Social anxiety disorder. Social anxiety disorder, also known as social phobia, involves a persistent and intense fear of social situations where one might be judged, embarrassed, or humiliated. This fear can lead individuals to avoid social interactions altogether, such as public speaking, attending parties, or even eating in front of others. The anxiety can be so overwhelming that it interferes with daily life, affecting work, school, and relationships. People with social anxiety often fear that others will notice their anxiety or see them as weak, which can perpetuate a cycle of avoidance and isolation. The cause of social anxiety disorder is thought to involve a mix of genetic, environmental, and brain factors. Treatment typically includes cognitive behavioral therapy, CBT, to help change negative thought patterns and behaviors, and sometimes medications, such as selective serotonin reuptake inhibitors, SSRIs, to help manage symptoms. Obsessive-compulsive disorder, OCD. Obsessive-compulsive disorder, OCD, involves recurring, unwanted thoughts or obsessions and repetitive behaviors or compulsions that people feel driven to perform. Obsessions can include fears of contamination, doubts about having locked doors or turned off appliances, or intrusive thoughts about harm. Compulsions are the actions taken to reduce the anxiety caused by these obsessions, such as excessive hand-washing, checking, or counting. While these behaviors might temporarily alleviate anxiety, they can become all-consuming, significantly interfering with daily life and functioning. OCD is believed to be caused by a combination of genetic, neurological, behavioral, cognitive, and environmental factors. Treatment often includes cognitive behavioral therapy, CBT, specifically exposure and response prevention, ERP, which involves gradual exposure to the source of anxiety without engaging in the compulsive behavior. Medications, particularly selective serotonin reuptake inhibitors, SSRIs, can also be effective in managing symptoms. With appropriate treatment, many people with OCD can learn to manage their symptoms and lead productive lives. Generalized anxiety disorder, GAD. Generalized anxiety disorder, GAD, is characterized by excessive, uncontrollable worry about a wide range of everyday issues, such as health, finances, or family. People with GAD find it difficult to control their worry and often anticipate the worst, even when there is no apparent reason for concern. This constant worry can lead to physical symptoms like muscle tension, fatigue, irritability, difficulty concentrating, and sleep disturbances. GAD can be debilitating, affecting a person's ability to function at work, school, or in social situations. The exact cause of GAD isn't fully understood but is believed to involve a combination of genetic, brain chemistry, and environmental factors. Treatment often includes cognitive behavioral therapy, CBT, to help individuals challenge and change their negative thought patterns and behaviors, and medications such as selective serotonin reuptake inhibitors, SSRIs, or benzodiazepines to help manage symptoms. With the right treatment, many people with GAD can learn to manage their anxiety and lead fulfilling lives.